When I went to work in Nepal as a family medicine resident, I thought it was my calling to work with people who need the most. I cared for a teenager who set herself on fire rather than being married off to an old man, a mother whose mud hut collapsed, caving in her head, people dying from illnesses simply because they walk for 3 days to get care or because they couldn't afford it. I came home shattered. How can I help when so many people don't even have the basics: a home, food, money for medicine? So I started listening to the voices around me. My friends helped me realize just how much a family physician could do, especially when you pay attention to those basic needs.
Working in communities that had very little resources, which I think attracted me to the fact that what could be done, having seen some of my Tibetan colleagues work there with very limited resources, doing great medicine in the area of primary health care.
Family practice really cultivates compassion in the physicians, and I think it's just because we're listeners as much as we're healers when we're in primary care, whether it's homeless people or people in the north who have addiction problems and domestic abuse problems, or overseas where there are lots of gender issues and cultural religious issues. I think it's so important when you're working with them to have that, to be culturally sensitive and culturally aware. I think that without that tool you can actually do more harm than good.
A changing moment came during a presentation on work being done by Calgary physicians in Laos. When they described how they help support a new family medicine program in this extremely under-resourced country, it was like an awakening. To make real change, you must teach.
A well-trained family doctor can look after most problems.
This project is very much about getting people there to take leadership roles in education and development of teaching. Moving from Siksika to Laos back and forth, these inequities are striking in their similarities. The relationship building that is necessary to be successful in one place is the exact same type of relationship building you need to take part in another place. The way you go about building those relationships might be different.
I learn, I think, more than I could ever give by being involved in this kind of work. And I think it's great to have medical students and residents involved in this work in the way that makes sense for them. You understand the world, I think, a little differently. You recognize our kind of common humanity.
Now that I am heading the Global Health Residency Program, I have come to meet so many champions serving the poor and marginalized even in my own city.
People who are disadvantaged for arbitrary reasons are the world over. It doesn't matter whether they're in our backyard or overseas, and it's certain adventuresome personality that likes to do both international work and is able to confront the challenges of working in inner city community health centers.
I come to work and I feel alive. No day is the same. I serve the marginalized and truly the underserved population in the richest country in the world.
In losing my path, I found my true calling as a teacher. And I have also discovered that the lessons I learn while working abroad can also be taught here. They've been taught to me by these amazing family physicians who work with vulnerable patients both in Calgary and internationally. How can you help? Who are the voices that guide you? Are you listening?